Thrombosis, Things You Should Know, Questions and Answers by Rumi Michael Lee. Introduction. I would like to thank and congratulate you for listening to this book, Thrombosis, Things You Should Know, Questions and Answers. This book will help you understand, revise and have a good general knowledge and keywords of thrombosis. Chapter 1. 1. What is thrombosis? Thrombosis is blood clots that block the blood vessels. 2. What is another name given to a clot? A clot can also be called a thrombus. 3. Can thrombosis be life-threatening? Yes, thrombosis can be life-threatening. 4. Can thrombosis happen at any age? Yes, thrombosis can happen at any age. 5. What are the two main types of thrombosis? The two main types of thrombosis are venous thrombosis and arterial thrombosis. 6. What is venous thrombosis? Venous thrombosis is a blood clot to the veins. 7. What is arterial thrombosis? Arterial thrombosis is a blood clot to the artery. 8. Can thrombosis be caused by obesity? Yes, thrombosis can be caused by obesity. 9. Can thrombosis be caused by fracture? Yes, thrombosis can be caused by fracture. 10. Can thrombosis be caused by an autoimmune disorder? Yes, thrombosis can be caused by an autoimmune disorder. Chapter 2. 1. Can thrombosis be caused by immobility? Yes, thrombosis can be caused by immobility. 2. Can thrombosis be caused by certain medications? Yes, thrombosis can be caused by certain medications. 3. Can thrombosis be caused by vein injury? Yes, thrombosis can be caused by vein injury. 4. Is smoking a risk factor for thrombosis? Yes, smoking is a risk factor for thrombosis. 5. Is diabetes a risk factor for thrombosis? Yes, diabetes is a risk factor for thrombosis. 6. Is paralysis of the leg a risk factor for thrombosis? Yes, paralysis of the leg is a risk factor for thrombosis. 7. Is obesity a risk factor for thrombosis? Yes, obesity is a risk factor for thrombosis. 8. Is an infection a risk factor for thrombosis? Yes, an infection is a risk factor for thrombosis. 9. Can immune disorders cause blood clotting problems? Yes, immune disorders can cause blood clotting problems. 10. Can atrial fibrillation lead to blood clot? Yes, atrial fibrillation can lead to blood clot. Chapter 3. 1. What is atrial fibrillation? Atrial fibrillation is when the upper chambers of the heart beat very fast, thereby not pumping blood properly. 2. What are the upper chambers of the heart? The upper chambers of the heart are the atria. 3. What are the lower chambers of the heart? The lower chambers of the heart are the ventricles. 4. Can atherosclerosis lead to clot formation? Yes, atherosclerosis can lead to clot formation. 5. What is atherosclerosis? Atherosclerosis is the buildup of plaque in the arteries. 6. Can hormone therapy lead to thrombosis? Yes, hormone therapy can lead to thrombosis. 7. Can blood disorders lead to thrombosis? Yes, blood disorders can lead to thrombosis. 8. What are the complications of thrombosis? The complications of thrombosis are breathing issues, heart attack, stroke, etc. 9. What is pulmonary embolism? Pulmonary embolism is block of blood flow to the lung due to a blood clot. 10. What is dyspnea? Dyspnea is difficulty breathing. Chapter 4. 1. What is necrosis? Necrosis is death of a tissue. 2. What is angina? Angina is chest pain. 3. What is a heart attack? A heart attack is a blockage of blood flow to the heart. 4. A heart attack is also called? A heart attack is also called a myocardial infarction. 5. What is a stroke? A stroke is a life-threatening condition due to a blockage of blood flow to the brain. 6. What are the signs and symptoms of thrombosis? The signs and symptoms of thrombosis are pain, swelling, numbness, weakness, etc. 7. Can thrombosis be prevented? Yes, thrombosis can be prevented. 8. How can thrombosis be prevented? Thrombosis can be prevented by losing weight, being physically active, stopping smoking, etc. 9. Can thrombosis be diagnosed? Yes, thrombosis can be diagnosed. 10. What is the diagnosis of thrombosis? Thrombosis can be diagnosed by blood test, ultrasound, venography, CT scan, MRI, etc. Chapter 5. 1. What are the treatment options for thrombosis? The treatment options for thrombosis include anticoagulants, stent, catheters, etc. 2. What are anticoagulants? Anticoagulants are medications used to prevent blood clots. 3. What is the main risk of thrombolytic medications? The main risk of thrombolytic medications is bleeding. Conclusion. Thank you again for listening to this book. I hope it has helped you in your journey to understanding thrombosis.